All right. All right. Well, good afternoon, everyone, at least everyone on the East Coast. Brandon Garrett here with the National Minority Quality Forum. So it's Friday, and I think on Fridays, you all know we like to edutain. So we like to just bring you some good information in the healthcare space. And I think this one is great, and we're talking about health literacy, and it's done by no group other than our very young communications and public affairs team. Ajua, as you've heard her lead these things before, but I don't know if you like if you guys know how extensive her background is in health literacy, health communications, whether it be doing this stuff with organizations like the Better Medicare Alliance, or working as the communications director for a senior member of the House Energy and Commerce Committee that focuses on healthcare. Ajwa leads a team that is just as skilled in this space. So with this, I'm going to go broadly and say it's health literacy, and I know it's more specific to that, but without further ado, well, with a little further ado, before I turn it to Ajwa, I just want to do some housekeeping things. One, if you have a question that you'd like to ask throughout the panel, please use the Q&A box below. And then if you just want to contribute to the conversation and keep things going with your own little tidbits and making it interesting, please just use the chat function. So that's all I have, I promise. And without further ado, I'll turn it over to people that are much better and more equipped in this space. And I'll turn it over to Ajwa and her team. So Ajwa, it's all on you.
Thank you for that, Brandon. Really appreciate it. Happy Friday, TGIF. Good afternoon. Say good afternoon in the chat so I know you're paying attention. Okay. If you don't say good afternoon, I'm gonna be like, Kyler, where are you? Tasha, where are you? Okay, so say good afternoon in the chat, please. Hi, Heather. Thank you for raising your hand. Dane, can you pull up the slides and I'll introduce the team here. I love to see the hands raised. Good afternoon. Wonderful. So today's conversation is health literacy in the misinformation age, because that's what we're in, you guys, if you didn't know that already. There's been a lot of conversation about this, so it shouldn't be new news that we are in the age of an infodemics. Hi, Tasha, good to see you. Good morning from Nebraska, good to see you. So infodemics, if you've never heard that term, basically means when there's an overabundance of information, whether it's good or bad or verified or not. So information, when we hear that word information, you automatically think that that's verified facts, and that's not the case, right? Information can be gossip, information can be lies. And so really, we're in an age where there's so much information being provided, particularly online and digitally, that some folks are having a tough time discerning credible information from misinformation. Okay, so because we're all in healthcare, this is having a real impact in healthcare to the point where it is being described as the next public health threat, misinformation, because we're seeing the correlation now between misinformation and uptake and utilization, right? So, patients deciding not to behave in a way that is best for their good health, or being unable to manage their health care or to participate in the health system with your doctor or your pharmacist or their care team because of misinformation. Next slide. So, oh, happy October. Next slide. So this presentation is being put on by the Center for Communications and Public Affairs, of which is the communications team here at NMQF. And we are in the business of communication, right? And we have a number of ways that we do that. And we're going to introduce to you today a couple of our programs, particularly Lift Every Voice and our For Your Health News platform, which how we are disseminating information and reaching patients and people with credible information and evidence-based health information. Okay, next slide. Okay. Actually, what I will do is I'll show my screen. Okay. View slideshow. All righty then. Okay. This is the team. So I'm Ajwa Chimarting, Vice President of Public Affairs and Communications here at NMQF. And the Center for Communication and Public Affairs includes Taylor Lopez, our Health Communications Director, who really leads our Lift Every Voice program, but is a health literacy expert. Okay, and so I'm just so glad to have her here for this conversation. Victor Mejia Lacayo, who is our marketing director, who is an expert on how to reach people online and digitally and on social media. We have Dane White, our internal communications and project manager, and Ashley Hill, our content marketing manager. This is a bit about what we do. Of course, media campaigns, thought leadership, education, patient education. We also really engage in creating culturally appropriate and relevant materials and websites. And we're always tracking about how can we make sure that we're reaching minoritized communities and disenfranchised communities, rural communities with health information despite all the challenges and barriers, including the digital divide. So let's talk about what is the landscape of 2025. The good practices for health literacy includes, of course, assume low literacy. Unfortunately, in this country, there are just too many pockets of low health literacy across the country. And it's really across demographics, across race, ethnicity, across age, just unfortunately a real problem of low health literacy. So that means that pretty much any material, any piece of communication, any email, any website, anything that's trying to reach people right now needs to be written at a sixth grade reading level and sometimes a third grade reading level. So of course, there's fluctuations depending on exactly the demographic, but the point is it used to be eighth grade and college age reading level, and now it is sixth grade, third to sixth grade reading level. Okay, so that means every piece of communication needs to be reviewed with that lens. Of course, we're in the age where everyone has a phone pretty much. So even though the digital divide still exists in many parts of the country, even in those parts of the country, they have a mobile phone. So the use of mobile apps, telemedicine, telehealth has grown immensely. Patient portals, chatbots, those are all ways that health information is being provided in a way that is accessible to patients. And so as a patient advocacy organization, we should be adopting the same tools in order to communicate and engage patients. So the way we do this is, of course, is you don't just put the information out there. It needs to be a two-way conversation, a dialogue, right? To ensure that a patient understands the information that's being presented to them and that you are answering even those silent questions that they might have, right? So that helps to ensure that the information is resonating with the individual that you're communicating with. So in any piece of material that, or particularly on social media or online, if you're asking open-ended questions like, well, what does this mean to you? Does this apply to you? Is this what you know? What questions do you have? That's very, very important in order to drive engagement, which is more important these days than impressions and views. It's engagement, right? So a lot of ways that you can do that too, particularly on your website, is embedding as much as possible quizzes, polls, anything like that, even on social media. So Facebook has that ability, to insert a poll. So does Instagram. So there's a lot of platforms right now because it's all about engagement. So speaking of engagement, even the creation of communication materials, it's really important to do so in a way that is collaborative with the audience that you're seeking to engage. So oftentimes at NMQF, we are previewing our materials with our patient network. So if you didn't know, NMQF has patient networks, and we'll talk a little bit more about that. As well as, with surveys. So you can actually put out surveys, get some feedback on questions, information. What do people know and what do they not know? That way you make sure that the information that you're providing is relevant. And of course, we're all about shared decision making in healthcare, right? So how we can best do that is, as much as possible, providing decision aids, interactive tools. What we do at NMQF, which we'll talk about a little bit more, is our patient empowerment guides, which basically help patients navigate the health system and ask the right questions of their care team. So the role of communicators is extremely important right now, more than ever with this misinformation age. Communication professionals have to step up if you're in healthcare. So we are often the ones that are building the trust, and we can also easily eviscerate that trust between an organization or a company and a patient, right? So trust building is so important, of which then we make sure that our communication materials are culturally resonant and relevant. And nowadays, I like to use the word socially relevant too, right? Because social conversation is permeating almost every aspect of our lives. And so that includes healthcare, right? So how does your material communicate to the lived experience of that patient, or of that demographic, or of that community, right? How are you bringing in examples that says, oh yeah, that does sound like me, that applies to me, so that they then decide to read further or engage further. So storytelling is extremely important. Being very open and cognizant about disparities in access and addressing it head on and saying, okay, but here are the solutions we're providing. Here's information you need to know in order to get access to this healthcare or these resources, by acknowledging the barriers that they might be facing. And of course, using simple language. So much of the communicator is that back and forth between making sure that it's accurate as much as possible and it's not misleading, but also very simple and clear. So that's always the balance, right? The tightrope that we all have to walk, but it's extremely important to make sure that it's understandable as much as possible. And of course, leveraging digital and even AI. So we will talk about that and how we're doing it at NMQF. First and foremost, if you haven't visited foryourhealthnews.com, foryourhealth.news, please do so. Please become a subscriber. Please share it with your patients, because that's where we're doing exactly what I just discussed, where we're turning research information, so the latest research and the latest evidence, right? So even real world evidence of drug therapies, or real statistics regarding the impact of any disease or condition or virus, especially. And we even are doing it regionally, so that it's really relevant to where people live, right? So very, very important nowadays, because in this health information ecosystem, people are engaging in the information that they want to engage. So if it's not speaking directly to them, where they live, who they are, who their family is, where are they from, it will seem as if it's not talking to them. They will not engage, and then the algorithm will suppress that information from them. So as much as possible, making sure that your information is speaking regionally, speaking in a social way, speaking in a way that is relevant to their lived experience. So we do that with For Your Health News, and we're going to get into it, but it's almost 8,000 articles a week that comes through that system, and then through people-driven news, so people-submitted news. Our Lift Every Voice program is where our patient networks live, and that's where we gather real patient stories from real people, some of them who are joining us today to share their stories about what it's been like, where we facilitate peer-to-peer communication, and where we are often getting real patient insights. And then we're going to talk about our Auntie Rona campaign, which is Anti-Rona is what we've decided to call the coronavirus as part of a campaign to reach what we call the movable middle. So people that are not pro-vaccine or anti-vaccine, but are just casual, everyday people going about their daily lives that may have tuned out regarding information because of the infodemic. And how can we reach those people? So we're going to talk about how we utilize humor to reach those folks. Okay. All right. So that goes right into cutting through the noise with humor to reach the masses. As I've mentioned, misinformation is a scourge on society, and no more has it been than vaccines, particularly the COVID-19 vaccine, of which we're seeing uptake really being hurt and utilization of the vaccine really being hurt by the misinformation. So if you're not aware, a lot of the misinformation on vaccines is being driven by Twitter, but it's across all the social media platforms. But it's particularly pervasive on Twitter. And of course, unfortunately, 80% of the vaccine information that's being provided on social media is negative. And it is targeting specific communities, particularly communities of color and minoritized communities, including rural communities. And it's targeting parents, and particularly for whatever reason, men. So this is research. These analytics you're seeing is research that NMQF conducted on behalf of a project for a government agency, in which we're currently undergoing more research in this regard with our anti-Rona campaign. Okay. So misinformation depresses uptake. There's been a lot of studies coming out already in regards to that. We're seeing that kindergarten coverage, so the purposeful linkage between autism and vaccines has really had an impact with young children getting the vaccines, because parents have been concerned. They hear it, they may or may not check the facts, and then they decide, well, they won't have their child be vaccinated. So this is a real concern that the CDC has noted already. And we're just seeing a lot of studies identifying higher hesitancy and even outright refusal. So how has NMQF responded? We decided, and really through a ton of research, that a lot of the misinformation on social media is driven in a viral nature. So it's super negative. It's created to drive disgust, which is a very strong emotion to unravel, and and fear. So one of the ways that you can attack fear is with humor. And another way to ensure that you go viral on social media, even with limited resources, which unfortunately a lot of the patient advocacy groups have now with cuts to funding for vaccine information programs, is humor. Humor with like what? Memes, right? GIFs and all of that goes viral on social media. So utilizing that information as experts, we created the Anti-Rona Watch, which basically is a website, and hopefully one of my colleagues can put that website in the chat box, but antironawatch.org, of which then you can track the latest updates regarding the COVID-19 virus. You can find out where to get the vaccine, because that's increasingly a challenge, right? Is where to get the vaccine, because now it changes from state to state and even from zip code to zip code in a drastic way, as well as tracks the misinformation, because we've realized as communicators that we had to talk about COVID-19, the vaccine, as well as the intentional misinformation at the same time. We couldn't talk about them separately. They are together in creating this very unhealthy environment for all of us. So, our campaign, it was intended to raise awareness that coronavirus is still a continued threat. to address the fact that misinformation around anti-vaccines is monetized, meaning that people are making money spreading misinformation, and that to counter it with humor that then leads them to verified facts and information, right? So the humor is a low barrier entry point to get the attention of people and then drive them to a website that helps them find resources and credible information. And it's, you might be asking why humor, but there's a lot of research that shows that that is how you can get access to a casual listener, right? A casual scroller. And that the movable middle regarding vaccines is about 71 million people. So it may seem like more people are pro or anti-vaccine, but there is a significant portion of people who are just don't care or undecided or just not tracking it because there are other priorities. And so that is still a group of people that can be talked to and communicated with. And there is a cultural tradition of using euphemisms. So Aunt Flo, right? So a lot of women are familiar with Aunt Flo, is often used to replace when people don't feel uncomfortable talking out loud about menstruation. My Aunt Flo has come to town. So similarly, because coronavirus has become a political football and a political conversation, creating anti-Rona is a way to talk about the coronavirus in a way that doesn't immediately ostracize and become a polarizing conversation, right? And so to the side here, the right-hand side, you will see those are real comments reacting to the anti-Rona campaign that NMQF has been running from real people. And it's funny that Mick Redbird uh, recognized immediately the connection with Aunt Flo and even made a joke of it, like, hey, Auntie Rona is becoming a scheduled occurrence. Yes, it wasn't just a pandemic. It didn't just come and go away. It is something that is regularly occurring because of various environmental factors. And so that is something that we all need to be aware of and make and schedule our vaccines in order to be prepared. Here, Brian Jones says, because so, as we created the character and with every season trying to attach the character to, again, everyday things. So during the summer, it was family reunions and barbecues, right? Don't let coronavirus keep you away from being around your family and friends. So here we said, the ad said, Auntie Rona brings COVID, not your favorite salad, right? And here Brian Jones responds with, she makes potato salad with raisins and doesn't wash her hands while making it. So he immediately applied and responded with the joke, with his own joke, and applied it to a real life. Okay. So I'm gonna now pass the baton, because I've been talking a lot, to Victor, our marketing director, who will share with you about what have been the results so far of this campaign. So yeah, we've had this concept and it was kind of crazy. Did it work? Victor, you let us know.
Good day, happy Friday to everyone. Thank you so much for joining us. So yeah, our anti-Rona campaign started in June this year, and to a short answer to Audrey's question, if the campaign has worked, the answer is yes. In the first week itself, we were able to reach over 200,000 impressions in the first week, and up to date, we have reached 1.2 million impressions and over 10,000 website visits. The one thing that I would like to also mention about the Anti-Rona Watch is the fact that we are also educating people through the website, because we are helping people locate information, understand that information, and ways to use that information in their daily lives. Um, the the campaign has run successfully in and we have used Meta, Facebook, and Instagram as our main channel. And despite what most people think that Facebook has is dying, it's not. It doesn't seem like that because there has been a lot of engagement in the campaign. As Adjo mentioned, a lot of people has responded in a funny way because Auntie Rona turns COVID into a familiar character. That nosy aunt who overstays her welcome. So people have taken that taken it as humor and have been completely familiar with have getting familiar with the character. And the good thing about Auntie Rona is that we have also put her in like it like the images like you can see in the images, she is right there in the pumpkin patch. And so Auntie Rona, be careful about Auntie Rona. If you're going to pick up your pumpkin for this Halloween, she might be there. And we are inviting people to uh, get vaccinated, to get educated, to get informed, especially because there's a lot of misinformation out there. There's a lot of fake news, and that is where Auntie Rona Watch plays an important role in this campaign.
So please leave questions if you like about Antirona, vaccine misinformation. We love to answer questions because we've done a lot of research here and really trying to figure out this very complex problem. Now I would like to talk about For Your Health News. Again, this is the news platform by NMQF, which it's engaged to provide complex information, right? A lot of healthcare information is complex in a way that is easy to read, and so we're providing this information in multimedia platforms. So video as well, audio, that's all done through our For Your Health News platform. Victor, would you like to say a little bit more about that?
Yes, absolutely. So, For Your Health News is a digital health media platform that amplifies the voices and needs of communities of color through culturally responsive reporting and expert reviewed explainers. Our mission is simple. We deliver accessible, accurate, culturally relevant information that closes gaps and care and advances equity. Uh, I think our main goal through each article that we curate, is to help people find the right sources, understand plain language, uh, cultural context of what's happening in the health uh, landscape, and use provide ways to use uh, all this information in their lives. Um, so I'm sorry, I got lost here. So we are also able to we focus a lot on research, expert voices. We also do a lot of content around tips and updates that benefit our communities. And as Ajwa also mentioned, we also have For Your Health News podcast where we interview experts in and invite people to understand the what the experts are saying in a very simple way that it's very digestible for them to understand in a very easy way. Um, in those podcasts, we have had featured guests like Joe Burvell, talking about myth busting and just combating that misinformation infodemic that's currently ongoing. We also have had Congressman Troy Carter when we were live at the exchange in Essence Fest this year. and Dr. Mimi Sanders as well. We have also the capacity for Your Health News podcast to do live coverage. We've been doing a lot of coverage in important events that are of relevance to our communities, like the CBC week a couple weeks ago. We were there, and we have also interviews there where we were able to interview doctors, physicians, caregivers, etc., on several topics that are of interest to our community and the communities we serve in For Your Health News. So our audience, well, we have this PSA video that we created. We can press play on it so you can see it. This is a PSA video that we are using for our social media campaigns and just to drive traffic to it. And once again, I want to invite people, if you have not subscribed to For Your Health News, go to FYH.News and subscribe. You will join our subscriber list of over 7,000 people who receive weekly updates on news, tips, and expert interviews from our For Your Health News podcast, and join the movement. Because this platform, as Adjo had mentioned, is a way to combat misinformation, just to put the right information in the hands of the people who need it the most, and that's what we are trying to accomplish with For Your Health News.
One thing I'll just add with that is that we're really excited about our new People Correspondence Program, where we're working with actually medical students. So medical students are going to be reporting on For Your Health News directly from their communities. We're really excited about that because research has shown that medical students are considered trusted voices within their own families and communities regarding health information, right? It's hard to say, hey, that this student has been bought by, a pharmaceutical industry, or that they're being driven by some corporate entity that wants to push a drug, right? These are folks that have obviously been trained in healthcare and are considered leaders within their communities. And so we're really excited about having them on our For Your Health News platform, and we'll be rolling that out particularly very aggressively next year across several communities. So hope you can join us for that. At this point, we've talked about health literacy and communicating to folks at the mass level, right? So through viral social media campaigns and through a news platform, which also, by the way, has its own newsletter, the For Your Health News newsletter, as well as SMS messages as well. So the For Your Health News sends alerts through SMS as well. But once you get folks' attention, how then does it translate into decision making and behavior change? That's when, from a communication point of view, you go from the awareness to persuasion to engagement, right? So that is really done more in an intimate way, and it still can be done online and through digital tools as well, which is what we've done with our Lift Every Voice program, of which we really help to facilitate and advance peer-to-peer communication, right? So we provide safe spaces for patients to share information. We also provide information to engage. And so at this point, I would like to introduce our Health Communications Director, Taylor Lopez, who runs the Lift Every Voice program, particularly our patient networks. Taylor?
Thank you very much, Ajwa. So our Lift Every Voice program is built on a very simple but powerful idea. And that is that patient stories are not just testimonials, but they're also data. They help us understand what's really happening in communities and where the system is falling short. And through this program, we really work to elevate patient narratives to inform public health messaging, advocacy, and care delivery, excuse me. And it's about restoring trust. So by putting lived experiences at the center of communication. And through this network, we're activating patients as partners and advisors to really help shape the materials, messages, and campaigns that reach their communities. And so we engage our patient network in many ways. So things like focus groups and storytelling to ambassador programs, surveys, and peer-to-peer discussions, all working towards our mission of reducing patient risk and advancing equity. Next slide. So to design effective and motivating health campaigns, we start by listening. Our patient needs surveys distributed through different platforms like Voter Voice and social media really give us a real-time insights into health topics that people typically care about the most. We usually keep them short, so 5 to 10 questions, so participation stays high. And we then work with our data team to overlay responses with local health data, which really helps us to spot trends and target our outreach much more effectively. Next slide, please. So we know that trusted messengers are essential for health education. And that's why we're building these peer-to-peer spaces like our Facebook groups and focus groups where patients can really share experiences and exchange advice and support each other. So these just aren't just chat groups. They're guided by expert information that allow us to collect insights and shape messaging. And we also prepare our patient ambassadors with talking points and guides so that they can spark informed conversations within their own communities. Next slide. So many of the existing health materials don't really speak to minoritized patients in a way that feels relatable or empowering really at all. So our team develops patient empowerment guides. These are tailored resources that help patients take a more active role in their care. And these include tools like talking to your doctors, questions about clinical trials, and guidance on partnering with different providers. We also produce things like posters, handouts, videos that are distributed through things like partner clinics or my clinical sites to really reinforce health literacy at every touch point. Next slide. So educating using patient stories. So storytelling is one of our most powerful tools. When people see and hear stories from people that look like them or share their experience, we found that it really breaks down stigma and isolation. So members in our patient network share their stories through video or written PSAs, uh, tending to normalize conversations around health, offering hope and motivating action. And these stories, they don't just inspire, they tend to drive really real measurable engagement and behavior change. Next slide. So providing expert feedback. Another way that we advance health literacy is by partnering with organizations to strengthen materials that are created. So even when partners already have agencies or campaigns in place, we can conduct health literacy reviews. So evaluating language, imagery, and strategy for cultural relevance. We also bring in our patient network to review these materials and give feedback directly from the intended audience. And that combination, so professional and lived experience review, ensures that campaigns are accurate, relatable, and most of all, effective. Next slide. So one of our most meaningful extensions of this work is our Support Our Sisters initiative, which is a peer network for Black and Hispanic women who are managing metastatic breast cancer alongside other chronic or long-term illnesses. We launched this initiative after hearing from women who felt pretty much invisible. So They're managing treatment, they're managing multiple medications for other illnesses, they're also still working, and also a lot of them are mothers, like they're still having to take care of their children at the same time. So through our quantitative and qualitative studies, we've learned so much about what these women are experiencing. When it comes to managing other illnesses, many of these women are contending with other chronic diseases like diabetes, mental health issues, cardiovascular disease, and hypertension. So polypharmacy is a huge hurdle for women dealing with MBC. Next slide. So the Support Our Sisters Peer Network is something that we developed, which is a safe and supportive space for Black and Hispanic women who are living with metastatic breast cancer, including those who are managing multiple chronic diseases. It's really a place to connect, share experiences, and access trustworthy health information. And within this network, women, they can uplift each other, they exchange practical advice, and find hope within each other's stories. So this group really, it was created to connect members to our broader Support Our Sisters resources, from educational materials to mentorship and virtual discussions. Next slide. So now I just want to share a short clip from an interview I did with one of our patient ambassadors, Shara Watson. She's a breast cancer survivor. She's one of our Support Our Sisters members. And in this quick snippet, Shara, she reflects on the early days of her diagnosis, how she found strength through support groups, and the way she prepares for doctor's visits by taking notes. And at the end, she ends with a really powerful statement of resilience, kind of just reminding us in her own words that at the end, she literally says, breast cancer will not kill me. I'm a survivor. We won't play the whole thing since I think it's about 6 minutes, but we could play about two minutes of it. Oh, sorry, Audra, I think when you first share your screen, you have to select share with sound. That's probably why you don't hear anything.
And I got a message through the My Care chart, and it said new test results. Now I'm at work, and I don't think that I will advise anyone to do what I did because I opened it up and I read the results. And it was like a long list of stuff that I didn't really understand, even being a nurse, but I understood that it said invasive ductal carcinoma. And I said, wow. And I lost it. I went and I cried in my boss' office, and I remember telling him, it's cancer, it's breast cancer. And I was in a I have joined about 3, I think, support groups on Facebook. I do a lot of videos for myself, and then I post them. And so when I post those videos, it could just be me just ranting. It could just be me just praising God. It could just be anything, putting out a scripture. But being able to...
And Audra, we can stop it right there.
Oh my gosh.
Just
there's someone else like me. Oh my gosh.
And she goes on to just talk about how she is, she's very active in support groups, how she's glad that she can connect with other women like her, and they feel the same way, and they can exchange their stories and share information. So very grateful to Shara for her sharing her story with me. And I just want to go off script really quick and just share a quick story, because what Shara had mentioned in that interview reminded me of an experience I had earlier this year with my great aunt, who was recently diagnosed with breast cancer last year. She's 92 years old. And when she told me that she had been diagnosed with breast cancer, for months she was telling me how she didn't want to go through treatment. She wasn't interested. She didn't want to do it. And my first impression was, oh, well, she's older. She's already dealing with other chronic diseases that she's taking multiple medications for. She's probably just tired. This is something else that she doesn't want to deal with. And she's an older woman from Wilmington, North Carolina. That's my hometown. So I decided to, drive down 95 and take her to one of her appointments. And sitting there with her doctor and her doctor explaining things to her and seeing in real time what the vocabulary and the terms that the doctor is using with my 92-year-old great aunt, I can see in real time that she's not understanding anything at all about what the doctor is saying. She's using vocabulary, she's saying things like mapping and lasers, and I'm seeing in real time, like, wow, I can't believe I'm actually witnessing this in person. My aunt she's not tired. She just doesn't understand. She's scared because she doesn't understand what the doctor is saying. So, and what Cher was saying when she got her results and her My Chart portal about, she saw the whole list of things she didn't understand. It's important for her provider to break those things down in a way that is understandable for her. Because even Cher, she works in the medical space and she still didn't understand, those things that were presented to her. But next slide, I'm sorry, I know we're kind of getting short on time, but I want to go to, we're having a quick conversation with Ms. Doretha Burrell. She is a breast cancer survivor and a proud member of our Support Our Sisters Network. Ms. Burrell, if you're there, join with us. I would love for you to be on camera if you can, but I'd love for you to start just by sharing just a little bit about your cancer journey, like how you were diagnosed, what were your first initial thoughts. So please welcome Ms. Doretha Burrell.
Thank you, Taylor, and thank you for the entire team at the Center for Communications and Public Affairs. As a breast cancer survivor, this is so meaningful for me. I was diagnosed January 3rd of 2007, which is, I am now an 18-year breast cancer survivor. And I'm grateful for life because 18 years ago, we did not have the medical technology that survivors have today. And one of the things that I can remember when I first walked into my doctor and he told me those terrible words, "You have breast cancer." The first thing I said to him, "Would you break it down in terms that I can understand?" Because when it started with all the long words, the titles, I truly didn't understand them whatsoever. So I'm grateful that I had an oncologist and a good health team that worked together to allow me to understand what I was going through. My breast cancer was a very aggressive form of breast cancer, and it was challenging. And again, you think back 18 years ago. When I look at survivors today, there's a new type of chemotherapy, and it warms my heart that there has been a big change from 18 years ago. As I mentioned, I'm thankful. I'm thankful now that I'm cancer free. But each time I speak about this journey, I think about the emotions that I went through, having to make decisions. Do I go through chemotherapy, radiation, surgery? And I decided to do all of those simply because I had an oncologist that took the time to listen to me. And one of my biggest speeches when I travel is the title, Listening to the Patient. Because when our doctors, our physicians, and our health team take the moment to listen to us and to hear our fears, I believe it really does help with our treatment. So it's so important for us to share our stories as cancer survivors. And I feel that I'm really being used, and I mean in a good way, for someone that has battled cancer 18 years ago and cancer free. But don't get me wrong, anytime there's anything that's unusual on my body, it always comes back to me. Oh my goodness, is this cancer returning? This will be a part of my life for the rest of my life. And because I've been so blessed to have had good treatment, I've devoted the rest of my life as a mentor in mentorship to help other women that are going through cancer. Because sometimes a woman just needs to pick up the phone and cry to someone else and not feel ashamed or feel embarrassed. And this is where life has taken me as a mentor and to do whatever I can to assist someone else. I try to smile a lot because sometimes that smile can go a long way when it's someone that's being diagnosed. And to be honest, there are very few months that I'm not conversating with someone just on a general conversation. And they tell me I've been diagnosed with breast cancer. So it's a big thing, it's huge. And it's important for us to share our stories and to be genuine with one another. Um, and for me, I'll be a survivor for pretty much the rest of my life.
And thank you so much for that, Teresa. I just want to ask you, I mean, there's so many questions that I can ask you, but unfortunately, in the interest of time, I do want to ask you just one more question. Um, what makes peer-to-peer conversations different from the information that patients may get from their doctors or like different online sources?
I think the peer to peer conversation is it's very intimate.
Mm-hmm.
When I attended a support group, I was surrounded by women that were going through some of the similar things as I were. For example, with chemo, sometimes you lose your taste and smell. So if I were to talk to someone else about that, they would have no idea what I meant. But peer to peer is very vital in the ability for a cancer survivor to feel that they can move forward. You're talking to someone who can truly understand, most especially when you're losing your hair. I know a physician can say to you, in so many days after being administered the chemotherapy, you're going to lose your hair. But to be with a peer to peer support group where others have witnessed and truly have experienced this, it makes a difference. And I suggest any person, woman or man, that gets diagnosed with cancer to immediately find a peer to peer support group.
Wonderful. Thank you so much, Doretha. For all of you who are listening, you can find Doretha in our Support Our Sisters Facebook support group where you can reach out to her, ask her questions, so share resources, share your story with her. She would be so happy, I'm sure, to connect with you there. Again, thank you so much, Doretha, for your story. It really captures the power of community and the importance of lifting every voice. And stories like Shara's and Doretha's, they've inspired us to create resources that help patients manage not just their treatment, but their overall well-being. And the resources that we co-developed with the Patient Empowerment Network, and Audrey, you can go on to the next slide, and I'll just talk briefly about what's there.
Right.
These,
I was just gonna say that also that
yeah.
that because I know there are a few physicians on the webinar today that trying to find either an online support network that you vetted or sharing obviously NMQF resources is very important, because of course, as Doretha has said, there's the advice and information you're going to get from the doctor. And I believe next week, our colleagues at SHC are going to talk about health literacy from a physician point of view. But it's nothing like when it's a person that's also going through it with you as well. It resonates differently. Go ahead, Taylor.
No problem. I know we're coming up on time, so I won't do a deep dive into all the materials here. But these were just materials that we co-developed with the Patient Empowerment Network, of course, with the help of experts in oncology care, nutrition, and mental health. The 4 resources you see here just talk about supportive care, so exercise and nutrition in cancer care, psychosocial challenges during cancer treatment, nutrition during cancer treatment, and then embracing the whole person, because of course, medicine is important, but we are learning that cancer patients are also looking for integrative ways to also treat their cancer. So with that, these resources, they really remind us that empowerment is more about than medical care. It's about whole person healing. So if you have any more questions or want to learn more about the initiative, you can visit supportoursisters.nbc.org, where you can view resources, survey results, and also join our peer network.
Thank you, Taylor. I think it's really important that folks know that these resources exist. These resources are the result of research, survey research that we've conducted, as well as social listening, NMQF social listening tools, as well as from the patients themselves. So when we talked earlier about health literacy in the way of co-collaboration, that's exactly where that comes in. Right. So it's not just what we think that folks need to know, it's what they say they want to know, what they say will be most helpful to them. And so these resources were created, really with that in mind, based on the evidence that was shared with us. Now, there's been a few questions here in the Q&A, so I'm just going to go right to them. One question was, I guess, when we were talking about misinformation earlier, has there been research on the goal of this misinformation? Are they wanting to hurt people? So I will say that in regards to vaccine misinformation in particular, there's been a lot of research and evidence, not just ours, that showed that a lot of this misinformation are coming from very specific sources, some of them foreign and some of them domestic, that are more political in nature, not health oriented in nature. And so, of course, we can only surmise why, a political entity or organization or think tank might want to spread misinformation regarding vaccines. But yes, it is intentional. This misinformation is most times intentional, and particularly when they're viral in nature, it is all designed for that purpose. So I hope we've answered your question. And so in a lot of ways, there are certain platforms that credible entities decided to stop engaging on because of the lack of regulation or the lack of controls on misinformation. But in a lot of ways, then we've left people to their own devices by doing that. So we've left people to the whims of folks who want to intentionally misinform, or folks who are not healthcare professionals, or are not trained communicators to do that with. So I hope I answered your question there. There was a question about nurses. Yes, there's a role that nurses play with health literacy. We focused on health literacy today from the communications point of view, but there's training, that NMQF provides for clinicians on how to better communicate with patients, and that is with our SHC team. Sure. We will, so if you're looking for there was a question about the patient empowerment materials, where to find them. So NMQF will launch our Lift Every Voice webpage that will be the directory of all of our patient empowerment materials that we've created soon. So if you want to get that first notification when we've launched, please send us your email. But if you want to find specific for the breast cancer patient network, please visit that website, support our sisters with NBC.org. If you're looking in terms of lupus, Victor, if you can provide the email, the website for that one, we have our beyond-lupus.org website where you can, for the lupus patient empowerment materials. Obviously for COVID, antironawatch.org. And for Alzheimer's, we have our patient empowerment materials, heart to heart. We'll put that in there. And then we also have patient empowerment materials for ATTR. Okay, any other questions? All right, I think we've answered all the questions and right on time. So we're putting the links in the chat. This recording, I believe there was a question about that. This recording will be available on our YouTube, NMQF's YouTube channel. So, okay, yes, Ashley has already shared that with everyone in the chat. The link to our YouTube channel. Please subscribe. That way you get the notification for the replay of this webinar. And thank you for your time today.